to bring humanity together and help any and every individual possible within their reach and capacity who is fighting cancer, be it in terms of financial assistance or maybe a second opinion or maybe hospital or network outreach and much more. And this is just a single branch of a huge tree. The foundation also empowers women, tackles environmental issues, and supports the farmers, promoting education by providing scholarship and whatnot. I'm more than grateful to have associated with your foundation and extend my services in whatever way I can. Now, before I begin to talk the today's topic, let me tell you that as much as the subject of cancer is deep, complex, and changing every day due to research and development, what we are going to cover today is just the tip of an iceberg. Therefore, I have covered what this dreadful disease is all about and how we can spot it, what are the early warning signs, and how we can prevent it. It's not easy to dig into the treatment, diagnosis of every cancer type within this short span of 1 hour, but I'm always available for you to reach out to continue this conversation even outside this link. And remember, the more you interact in the comment section, the more you will be able to know about today's topic. So, let us begin our session with busting common myths around cancer. So, what I will do is I will show you few statements. I want you all to quickly type in the comment section whether this statement is a myth or a fact. That way, we will be able to interact and learn more. The first statement: cancer is a disease of old age only and it can't occur in a child. So, what do you guys think? Is it a myth or is this truth? Okay, okay. As most of you have correctly spotted, it is a myth. And cancer is a disease not only affecting old age, it can occur anyone and everyone at any age, and even a newborn baby per se. For example, newborn babies can be born with neuroblastoma kind of a cancer or leukemia. That is, yeah, that is a blood cancer. In even in my experience, I have witnessed few infants to 2 year old cancer. This means that cancer can happen to anyone. It does not differentiate what life stage you are in. Right now, let us move on to second statement, and do let me know what you consider. Is it a myth or a fact? The statement is only individuals whose parents or family members have history of cancer can get cancer. Do write in the comment section what do you think. Is this a myth or a fact? Okay, okay. Like most of you again pointed out correctly that only about 5 to 10% cancers are hereditary. The remaining 90 to 95% are caused due to other factors like lifestyle changes or environmental factors, food, etc. This means that a person may be prone to cancer either from inherited mutated genes or due to mutation by environmental factors. Right. Let us move on to one more statement and do let me know what is it, a myth or a fact. That cancer is not contagious. It does not spread by touching, by staying close, or by touch. What do you think? Is this true, myth? Is this myth or a fact? Okay, wonderful. Again, you guys correctly spotted it out. This is fact. Cancer is not contagious. A lot of people think that by staying with people who have cancer or eating food with them, sharing clothes, or even visiting their homes can lead to contracting the cancer that patient has. But this is absolutely false. For instance, uh, let us talk about tuberculosis infection. Tuberculosis infection is contagious, but lung cancer, let's say you are visiting two people, one patient having TB and the other one having lung cancer. The chances that you might contract TB is more, but you won't contract the lung cancer by visiting just the patient of lung cancer. So it does not spread directly by touching or staying together. Now, so Cancer need not be a death sentence. Cancer has just become a taboo and is associated with a lot of social stigma. But it is not a death sentence. As a society, we either start showing pity to the patient and their family, or just blame the patient who is suffering from the disease, or simply ignore them altogether. The most common thing that we do is offer unsolicited and unnecessary advice to the patient as well as the family. All of this just ends up being very stressful and traumatic for the patient as well as the family who are already battling with the disease. Everyone fears that getting diagnosed with cancer means this is the end, but no, it is not so. The likelihood of survival after getting diagnosed with a cancer has increased significantly since 1990s. To put down the data, the 5-year survival of few cancers like breast cancer, prostate cancer, or thyroid cancer has reached around 90 percentage. This just means that if you are diagnosed with such cancers and if you take the treatment properly, the chances of you or the patient surviving for next 5 years is 90 percentage. That is a big number. And this is just the result of better screening, treatment, advancement in the technologies, and the pharmaceutical inventions we have currently. So, why have we met today? What is the point of our meeting today? Why are we having this conversation around cancer? So yes, one of the reason is coincidentally day before yesterday, November 7th, is declared as the National Cancer Awareness Day by India since 2014. But this is beyond. This is something beyond this. Now that I have attempted to reduce the stereotype towards cancer, let me give you a reality check. So the incidence of cancer is increasing. Definitely yes. This is because of the increasing longevity, changing of the lifestyles, the increasing pollution, mutated genes, and many other factors. One data suggests that in the next 15 years, 1 out of every 6 people will have cancer, which means that at least one member of every family will have a patient suffering from cancer. And this is not just to scare you, but so that's why we have met today to understand what exactly the cancer is and what to do to prevent it. The most common cancers in the world are lung, breast, and colorectal, while in India, the most common cancers among women are the breast cancer, the cervix cancer, and the ovarian cancer. While for men, it is the lip and oral cavity cancer, the lung cancer, and the esophagus cancer, that is the food pipe cancer. And over 1/3 of all head and neck cancers of the world are affected to Indians. And in India, 60 to 70% of cancers, that is almost 2/3 of all the cancers detected, are diagnosed late in the advanced stage when treatment is really very hard. So this is why, and the early detection saves lives. So cancers like breast, cervix, oral, and colon are curable if they are found very early in the disease. So this is why to deal with this disease in future, with readiness, with awareness, we all need to know the basics about cancer and its causes, the early signs and symptoms, and how we can prevent it. I believe that we fear what we do not understand. And in this case, cancer has been the most misunderstood disease thanks to the false representations in the movies, fake information on online platforms, quack influencers who give out false hopes of removing or eradicating cancer completely or not contracting cancer at all using various gimmicks. There is too much noise out there in terms of false information, and we understand the reality very less. So, this is why we fear it the most. And exactly this is why I'm here as an expert in the field and maybe a Shubchindak to create awareness about cancer so that together we are ready if and when it affects our loved ones. So let us start by what is cancer? Cancer, the term is not one disease. It is a group of diseases. So imagine it as where some cells in our body they start growing out of control and they forget how and when to stop. Normally, our body cells grow, divide, and die in a controlled way. But in cancer, this control system is lost, and the cells keep multiplying even when they shouldn't be multiplying, leading to formation of a lump or a tumor, or sometimes even spreading through the blood to other parts of the body. So our body is like a well-managed city. Each cell has a job and it follows rules. Cancer happens when some cells stop following these rules, like a few citizens creating a chaos in the city, and they start damaging the whole city. So what actually happened is, because of these environmental factors or because of the lifestyle factors like tobacco, radiation exposure, or infection to various virus or bacteria, this all leads to DNA damage or mutation in our body, which leads to loss of growth control. And so the cells continuously keep on dividing, and they don't stop this cell cycle division, which eventually leads to formation of a tumor, which might spread to other organs, which is known as metastasis. Also, we need to understand the difference between benign and malignant. Cancer is often confused with tumor. Neoplasia, for that word, is a purposeless growth of cells. It can be of two types, benign or malignant. So, what we understand from benign is that it is a harmless growth and normally called a tumor, which are slow growing and almost never spread to distant organs. I guess many of you would be having small lumps all over your hand or maybe other parts of the body. It is just a mere tumor of fat cells known as lipoma. It is not cancer. You will be having many such tumors throughout the body. So, but what is a malignant neoplasm? It is a it is a harmful one, which is called cancer. This is which is fast growing. It infiltrates into the local tissues and it spreads to the distant organs also. Eventually, it might lead to death if not treated at a given time. The spread of this cancer to distant organs is called metastasis, and which is the fourth stage of the cancer. The common organs affected by metastasis are lymph nodes, liver, lungs, or bones. Now that we know what is cancer, let us dig a little deeper into what are the stages of various cancer. It is the first question I face in my OPD when any patient is getting diagnosed with cancer. The patient and the family members come and ask, "Sir, what is the stage of cancer?" So, although all the cancers have specific staging system, but there are broadly four stages to all cancers. Let me explain these four stages with a very simple example of fire. Consider cancer as fire. So, what is stage zero? Stage zero is carcinoma in situ. Imagine that this is the stage before the fire spreads. And this is a very early stage, limited to the place where it started with no invasion yet. Then it progresses to stage one, is when the fire is limited to just one room of a building. That is only a small cancer that is limited to organ of origin like breast or lung. If the cancer is diagnosed in this first and second stage also, it is very much and very easily treatable. So what is second stage? Just imagine as that now fire has started to affect the nearby rooms. It is not limited to one room. Now it has started to affect the surrounding rooms. That is a larger tumor or involvement of surrounding tissues or very nearby lymph nodes, but it has not spread to distant organs. Then comes the stage three. Imagine it as when fire spreads within the building. It has not gone out of the building, but it is spreading throughout the building. That is, cancer has spread to more lymph nodes or the surrounding tissues, but still not to the distant organs. And then comes the stage four, that is the last stage where fire has reached another building. It means that the cancer has spread to distant organs, as we discussed, just like liver, lungs, bone, or brain. But for the information, even stage 4 cancers today are still curable. It is not so. The notation previously was like once you are diagnosed with stage 4 cancer, it is over. But no, even stage 4 cancers to certain extent are curable. And so definitely you should go and see an oncologist to know what are the options, right? So now that we have seen the stages of cancer, let us understand like uh, what are the causes of cancer. This is a very common question people ask us in OPD. Sir, like what happened to me? Why it happened to me? So the to be honest, the exact cause of cancer is not known till date, but it is believed that the changes, the mutations in the genes lead to cancer, and these mutations may be caused by various factors like tobacco, alcohol, various infections, unhealthy lifestyle, environmental and occupational exposures, or maybe genetic factors and aging. These are just to name a few, and the list goes on and on. So, sharing my personal opinion, most of the cases I see in OPD are those of tobacco consumption, both in the form of smoking and smokeless. And it is the biggest cause of cancer amongst Indians. Around 30 to 40% of all cancers, including oral, lung, larynx, esophagus, or urinary bladder, are caused by tobacco. So even tobacco could be smoking or smokeless. Smoking in form of cigarettes, bidis, or hookah, and smokeless in form of chewing tobacco, gutka, kheni, etc. And also to understand that even passive smoking increases the risk. So if you feel that, oh, my father or my brother is smoking, so I'm not at risk of having cancer. No, if you are staying in the same household, in the same closed space, then even you are at an increased risk of having lung cancer or other cancers in that matter. And these days, there are many youngsters and individuals who are shifting to e-cigarettes to avoid the harms of cigarettes and yet experience the flavored smoking. But even e-cigarettes are harmful. And to emphasize again, no form of smoking is harmless. And alcohol, when taken along with tobacco, acts synergistically, and the risk multiplies when both are used together. Now, coming to infection, around 25% of cancers in India are linked to infection. Some cancers are easily preventable with simple vaccines against these infections and early treatment of infections. Such as, for example, we have HPV vaccine, which prevents cervix cancer in females. And also, there is a treatment of H. pylori bacterial infection that prevents stomach cancer. H. pylori infection is so common that around 50% of the individuals do have H. pylori infection during their lifetime. But it is easily treatable, and if treated, it does not lead to stomach cancer. Only very few people with with H. pylori infection might end up having stomach cancer. Then the another common cause is obesity, lack of exercise, junk food, high amount of red meat intake, or low amount of fruits and vegetable intake. This all increases the risk of cancer. Also, pollution that we face a lot these days, then chemical exposure like asbestos, pesticides, radiation, all of this can damage DNA. And people working in industries like construction or mining industries, or even dye manufacturing industries, are more at risk. So we learned earlier that hereditary is not the only cause of cancer. Only 5 to 10% cancers run in family. For example, let me say BRCA mutation. I don't know, many of you might have heard BRCA. It is a gene mutation that runs in the family, and it might lead to breast and ovarian cancer in the family. So the family history does not mean destiny, but it surely means that you should be aware and you should undergo regular screening. Now, let us understand which are the five most common cancers in India and understand in details about each cancer. For males, as I had previously said, the most common cancers are lip and oral cavity, followed by lung cancer related to again smoking, followed by esophagus cancer, again related to smoking. For females, it is the most common is the breast cancer, second followed by cervix cancer, and followed by ovary cancer. So let us understand like what are the early warning signs of each cancer in detail and what you can do to screen them. Firstly, let us talk about the oral cavity cancer. As in India, the amount of tobacco users are day by day increasing. I, I'm really sorry. The slides, the images on the slides might be scary for you, but these are the signs you need to watch out for. So, what are the various signs that if you notice, you should go see a dentist or an oncologist? An ulcer which is not healing within 2 weeks, or if you have a persistent red or white patches on the tongue, gums, or lips, or if you have a persistent lump or swelling in the oral cavity and neck, or you have continuous pain or numbness over your face or chin, and a voice change, difficulty with chewing or swallowing, or moving the tongue or jaw, or if you have a loose teeth or ill-fitting dentures. So all of these are pointing somewhere to a cancer or a tumor which you cannot still see. So in if you have any of such signs and symptoms, you should definitely go see a dentist or oncologist. And for now, screening, if you are a chronic tobacco chewer or smoker, make sure that you are inspected by a doctor regularly, especially if you are taking tobacco since long years. Now, I would show you a short clip regarding how to screen yourself for oral cavity cancer. So, let us see and understand how to examine our own oral cavity, and if you find anything, we can go see a doctor. Just a minute.
It's not just your dentist who can check for signs of oral cancer. You can too. Conduct a self-exam once a month. With a light and a mirror, look around your lips, mouth, cheeks, tongue, and gums for any changes. And if you notice any symptoms like swelling, bumps, and rough spots in or around the mouth, velvety white or red patches in the mouth, unexplained bleeding in the mouth, unexplained numbness or tenderness in the face, neck, or mouth, sores on the face, neck, or mouth that don't heal within 2 weeks, difficulty chewing or swallowing, hoarseness or a chronic sore throat, a painless mass on the neck. Schedule an appointment with your dentist and healthcare provider. If any tissue looks suspicious, a biopsy can confirm cancer. Oral cancer can be scary, but if caught early, it is curable. Pay attention to any changes in your mouth, get regular dental checkups, and make some positive lifestyle changes to help decrease your risk. Remember, early detection is key.
So yeah, this was the few signs which you need to look for in the oral cavity, and if you find anything, go see a doctor. Now let us move on to next cancer, that is the breast cancer, which is the most common amongst females. And nowadays, we see even younger females. By young, I mean 20 to 25 years old, also in our OPD, coming with a complaint of breast lump. So that's why the breast awareness is very much required these days. Not every breast lump is a cancer, but on like for the younger age group, most of them are benign tumors. But still 5 to 10% might end up having cancer, and so we cannot ignore them. What is breast cancer linked to? It is linked to increasing age, obesity, nulliparity, that means you have no children, or late age at the first life childbirth, or other hormonal factors and family history. So, and what are the common warning signs that you need to see and check if for the breast cancer? First is a lump in the breast or underarm. Yes, even the underarms are need to be checked. These are commonly neglected areas. Second, you can have skin changes like dimpling, which is resembling an orange peel. You see an orange, the skin becomes just like an orange peel, or it can get converted into red and like having irritation of the breast skin. The third is the nipple changes. Like you can have retracted nipple that is turning inward of the nipple, or you can have nipple discharge, which could be plain cystic discharge or blood stain discharge, or you can have new redness or scaliness of the nipple. You can also feel enlarged lymph nodes in your armpit. If you feel any of these changes, you should directly go and get checked by a proper breast surgeon or a gynecologist in that case. And now let us see what are the screening methods for breast cancer. First, it begins with, let's say, if you are a 20-year-old female, then begin screening with self breast examination. So nowadays, this is an old term. The self breast examination has been replaced with breast awareness. It The guidelines say that the lady should be breast aware, how her own breasts look, and if at all you find any changes in the appearance, or if you find any swelling or any nipple discharge, you must go see a doctor. And ideally, it is recommended that to do it every month or every alternate month on fifth or sixth day of the periods, when you will be able to find the lump easily. Second thing is clinical breast examination. What does it mean? Let's say if you are reached the 30 years of age, you just go and see a doctor once in a year or maybe 3 years to get checked if you have any suspicious signs or not. Then comes, let's say if you are now turning 40 years of age, then the recommendation is that you should get annual mammogram done. This is for normal people, but for high risk patients, what do I mean by high risk patients? Let's say if you have family history of breast cancer or ovarian cancer, or you have a known genetic mutation, what I talked earlier regarding the BRCA mutation. In that case, the breast cancer screening should start at 30 years, and it should include mammogram as well as MRI, both annually, and both to be done every alternately. That means that every 6 months you should be undergoing one of the two screening methods. I'm again consciously emphasizing the need to have these screenings because most of the time what happens is the women, as we all know, neglect their own health while taking care of their loved ones. I urge everyone in this group today, naturally the females and but also the males, to make sure that these screenings take place regularly. To all the males, you can help your female friends, family members, and partners to detect any warning signs because the earlier we detect, the brighter are the chances of getting rid of cancer and leading a normal life again. I'm again going to show you a small video of how to do a breast self examination explained in a simple and informative way by one of my mentors, Dr. Rohan Khandelwal sir. So let us see how to do the self breast examination. Just a minute. I'll switch on the video.
So the first thing the lady has to do is that she has to stand in front of the mirror and put both her hands on the hips, just like Supinder is demonstrating. And when she does that, she has to see if both the breasts are looking equal. Is one breast looking bigger than the other one? Is the nipple on one side higher as compared to the other side, or is it being pulled inside? So these are the things which you need to observe on your own. After that, the lady has to put her hands above the head and then see if the nipple is being pulled inside on one side, or is one nipple riding higher as compared to the other one. Once you've done this basic checkup, then the next part happens when you're taking a bath in the shower. So in the shower, what we recommend is that you apply soap on your hand and some soap on your breast, as this increases the sensitivity of you detecting a lump. The lady should keep one hand behind her head, and if you're examining the left breast, then it needs to be done with the right hand. Now, a word of caution here. Whenever you're doing the self-examination, it should be done using 3 fingers and the pulp of 3 fingers, not the tip, please, the pulp of 3 fingers, right? And never feel the breast like this. Never hold the breast tissue between your thumb and 4 fingers, because if you do that, you'll always feel a lump. And I get at least 20 such patients in my OPD that they say that they're feeling a lump, but in reality, they're just doing the examination in the wrong manner and they pick up a lump, when actually there's nothing there. So again, with 3 fingers, the pulp of 3 fingers, hand behind the head, and then you feel for the breast in a circular motion against the chest wall. The same process has to be repeated on the other side, and you should feel for the area behind the nipple right at the end, because that area can be sometimes a bit sensitive. So this entire process just takes around 5 to 7 minutes, but it can help you detect a breast lump early. I hope we've discussed the process with you in detail, but as I've told you, this should not be done in isolation. If a lady is above 35 years of age, once a year she should visit her gynecologist or a breast cancer surgeon for a thorough examination. And if the lady is above 40 years of age, then you need to do a mammogram every year. Those who have a family history of breast cancer or ovarian cancer, you need to meet a doctor, as in your case the frequency can be much more as compared to a normal lady. So just by doing these simple steps, you can help in picking up a lump early. And if you pick up breast cancer early, then the treatment is also curtailed and the survival rates are much higher. Thank you.
So these were the steps of how to do the self-breast examination. I hope you all understood it. And I would again urge all the males as well who have joined the session to take this seriously and motivate the female family members and their partners to undergo self-breast examination and the screening as we discussed regularly. So now let us move on to the next cancer, which is the second most cancer amongst Indian women. About cervical cancer vaccine and regarding the sugar. Let us go through the session. I will address those questions at the end of the session. I guess most of them will be answered by then. Let's see. So let us talk about the second most common cancer amongst Indian women, that is cervix cancer. Cervix cancer is something that is almost always caused by a persistent HPV virus infection. So, what are the early warning signs of cervix cancer? It is maybe abnormal vaginal bleeding, that is, bleeding between the menstrual periods, or after a sexual intercourse, or after menopause. Or you might have unusual foul smelling vaginal discharge, or maybe just a vague pelvic or lower abdominal pain or a backache which has lasted for a long time and is not resolved by taking the normal painkillers. In that case, you should go consult your primary doctor. And now let us see what are the screening methods for cervical cancer. So, what is the target population for screening? It is everyone between the age of 21 to 65 years who are sexually active. And the screening method options include usually visual inspection with the use of few chemicals like acetic acid or Lugol's iodine, This is usually done in country with having limited resources like India, and it is to be done every 3 to 5 years. But what is recommended by guidelines is using a pap smear test. It is basically just taking a sample from cervix and undergoing a cytology test to be done starting from 21 years of age and to be repeated every 3 yearly. But once you are 30 years of age, the HPV DNA test is added on to the pap smear test, and this co-testing is to be done every 5 yearly. So there is a relaxation of 2 years if co-testing is done. So most of us wouldn't be aware of such screening options and would be very skeptical of undergoing these screening tests because we always feel that this will never happen to us. And so why should we undergo these tests? But to your surprise, the data speaks completely the other way around. Cervix cancer is the second most common cancer amongst Indian women and is also the second most common cause of death among Indian women. But if detected earlier, that is within stage 1 or 2, the treatment for cervix cancer is a simple surgery that involves the removal of uterus after the childbearing age is completed or the family is completed. So the screening is very, very important. And also, this cervix cancer can be prevented with giving HPV vaccination. The recommendation for this vaccine is for all girls aged 9 to 14 years. I guess I'm answering your question, Sarju, that all girls of 9 to 14 years of age should be given 2 doses of HPV vaccine. And if that age is missed, then you can still do a catch up vaccination for all the girls of 15 to 26 years old with 3 doses of HPV vaccine. And nowadays, the HPV vaccine is also recommended for the male partners. The fact is that HPV infection for males, if chronic infection occurs, it might lead to even penile cancer. And they may spread the HPV infection to their female partners. Just to prevent this, the HPV vaccination is also now recommended for the male partners. And the good news is that government of India is now planning to conduct a nationwide cervix cancer vaccination program. So let's hope that most of the girl childs are getting the vaccine and prevented from this cervix cancer. I guess this is too much of facts and data for you. Let us move on to one more myth versus fact quick chat. I will give you a statement. Open your chat box. Do let me know if that is a myth or a fact. The use of knife or biopsy or surgery can spread cancer. What do you guys think? Is this a myth or a fact? Write down in chat box. Okay. So I guess there is a mixed response, but majority of you have answered it correctly that it is a myth. For people who consider this as a fact, the use of knife or biopsy or surgery can spread cancer is not true. Biopsy is the first step to detect most of the cancers and plan treatment. And surgery, whenever possible, is the most effective method of treatment in majority of the cancers. It removes the cancer cells and makes chemotherapy and radiotherapy more effective. You might have seen many people saying this that we underwent a biopsy and then the cancer spread very rapidly and we ended up having the last stage of cancer. But mind you, in my practice, in like all of my colleagues' practice, we have not seen such patients. It is only when you undergo a biopsy and don't take treatment, just roam around here and there for a month or two, then it is but obvious that the cancer is going to increase at its own pace. And so it is the cancer's pace that led to stage 4 disease and not the biopsy per se. So it is very, very important to remove this myth from your minds. No, biopsy does not lead to the spread of cancer. Now, let us move on to one more myth or fact statement. Let me know in comments what do you think. The statement is that Only people who have very poor lifestyle or smoke or chew tobacco or drink alcohol get cancer. What do you think? This is a myth or a fact? Okay, I'm getting responses. Yes, as most of you correctly identified, it is a myth. Now I started getting mixed response, but most of you correctly identified that it is myth. A healthy lifestyle can reduce risk of some cancers, but it does not guarantee prevention. But having said that, consumption of tobacco and alcohol puts a person at a higher risk of getting cancer. So now let us explore how lung cancer works. Lung cancer most commonly occurs because of tobacco smoking. So, what are the very, it is very common amongst elderly people who are chronic smokers. By chronic smokers, the data says more than 20 pack years. Let us not go into detail about it, but what are the most common early signs to look out for? Lung cancer. It is chronic coughing lasting for more than around 3 weeks and not getting treated by normal medicines, or if you are having hemoptysis, that is coughing out of blood, or you are having shortness of breath, change in voice or chest pain, or maybe you might be having unexplained weight loss or fatigue. All of these signs might be leading to lung cancer. So what to do for lung cancer screening? If you are a chronic smoker and an elderly person that is more than 50 years old, you should undergo lung cancer screening by getting an annual low dose CT scan done. What do you mean by low dose CT scan? So low dose CT scan are special CT scans with a much less amount of radiation exposure than a normal CT scan. Why so? So that the person is not exposed to a higher dose of radiation that might cause a second cancer. So this is a very safe process of undergoing a lung cancer screening. And I would urge everyone, if you cannot stop smoking, the first step is to stop smoking. That if you're not able to do that, and if you are of 50 years above, then please go get a low dose CT scan done annually and meet your oncologist to follow up as and when required. Now, let us see one more myth or fact statement. This is very common amongst people, and as you all know, a few years back, it had splurged like anything. The statement is that sugar makes cancer grow faster. So I want to know what are your thoughts? Is this a myth or fact? Okay. Wow. Almost all of you are saying that this is a fact, but let me just blast the fact that it is just a myth. Why so? I will try to explain that all cells, including the cancer cells, of course, they need sugar for energy. But there has been no evidence that eating sugar directly feeds cancer, or that cutting down on sugar will make the cancer tumors shrink or just disappear. No. Instead, what happens is a high sugar diet can lead to excess weight gain and obesity, which in turn is a risk factor for several types of cancer. But once you are diagnosed with cancer, it is not so that cutting down on sugar will help the cancer patient heal faster. So please don't advise the cancer patients to cut down on their sugar intake. Let their dietitian decide on the amount of sugar they need according to the treatment they have to undergo. Right? So now let us move on to one more, third most common cancer amongst Indian women, that is ovarian cancer. And this ovarian cancer is also associated with the hereditary mutation that we also saw in the breast cancer, that is a BRCA mutation. Usually the ovarian cancer has very vague symptoms and it can be easily mistaken with bowel cancer. So like what are the common signs? Still, let us see. It is abdominal bloating or swelling which is persistent and doesn't go away. Then quickly feeling full, that is just you have difficulty eating or you have loss of appetite after just eating a small amount of food. or you might have a pelvic or abdominal pain which is persistent and does not go away even by taking the normal painkillers, or you might be having frequency or urgency of urination or change in bowel habits because of the mass down there in pelvis creating pressure amongst over the urinary bladder or large intestine. So what about ovarian cancer screening? For normal women, the guidelines do not recommend regular screening. It is only for the females who do have a known BRCA mutation and who are at increased risk of ovarian cancer and breast cancer. The recommendation is undergoing an annual ultrasound examination with a CA-125 blood report. Right. So now let us move on to one more not so common cancer, but uh, common amongst the males, which is prostate cancer in elderly age group. So, what are the common early warning signs of prostate cancer? You might be having frequent urination. You might be getting up multiple times at night, even 3 to 4 times to urinate. So, or you might be having difficulty in starting or stopping the urination. You might be having weak or interrupted stream of urine than usual. You might be having a feeling of incomplete emptying. So all of these signs, they are similar to a benign condition called benign prostatic hyperplasia, which is very much common in elderly male. So this signs does not directly mean that this is prostate cancer. What the recommendation is that you should get a PSA blood test, that is prostatic specific antigen blood test, at 45 years of age. Depending, and later on, depending upon the result, the screening is individualized after discussing with the doctor. So like there are over 100 different types of cancers. I have tried to focus on one of the most commonly seen around us. Due to time limitations, we cannot cover each and every cancer in detail. But remember, the key takeaway is awareness, early detection, and timely medical consultation is foundation for all cancers. Now that we know what are the different types of cancer, let us move on to an important part of this session regarding cancer prevention. What can we do to prevent cancers? Many people, like many relatives, ask us कि सर इनको तो हो गया, हम क्या कर सकते हैं कि we can prevent cancer from occurring. The first step starts by bringing discipline into our lives. First thing that we can do is quit tobacco completely. By completely, I mean there is no level of tobacco use that is safe. And as per the American Cancer Society, tobacco smoke carries more than 70 known cancer causing chemicals. It not only affects lungs but also increases the risk of cancer in head and neck, pancreas, urinary bladder, and even cervix. And also, as we discussed earlier, the smokeless form of tobacco causes increased risk of oral cavity cancer. Avoiding second-hand smoke is also equally important, and it can be just as harmful to family members and co-workers of chronic smokers. What is the second thing we can do is exercise. So move your body every single day. Exercise doesn't have to mean heavy workouts or long gym sessions. Minimal activities like brisk walking, cycling, or yoga, even for 30 minutes a day, can help play a role in reducing cancer risk. So, regular movement helps maintain healthy weight, which lowers the chances of cancers linked to obesity. Right? What else we can do is eat real food and not processed plates. A diet high in fresh produce and low in processed items is one of the simplest cancer shields. So eat more fruits, eat more green leafy vegetables, or eat whole grains, which brings antioxidants and help you to fight cancer cells. Like, and also do limit red meat intake, skip the processed meats like sausages, etc. And keep sugary foods to rare occasions. Don't eat too much sugar. Again, that does not cause cancer, mind you. It just leads to diabetes, leads to increased obesity, which indirectly causes increased chance of having cancer, right? Then keep alcohol to a minimum. So, as per the National Cancer Institute, even moderate drinking has been shown to raise the risk of few multiple cancers like breast, liver, or colorectal. So, what happens is when alcohol goes into the body, it turns into a toxic chemical that damages DNA, and this leads to cancer development. If you drink, keep it to rare social occasions and not as a daily habit. And let's say if your social occasions are happening daily, that does not mean that you drink daily. Please. Now you might be wondering what is the safe level of drinking. So when I researched, one national source quotes that if you drink less than 14 units a week, that is around 140 ml a week, it is considered as low risk drinking. But this does not mean you go around and tell everyone that Dr. Shalin has said that we can drink up to 140 ml alcohol a week. No, that is a big no. Even that source has mentioned that it is low risk drinking and not safe drinking because there is no safe drinking level. So, my advice to you all will be no alcohol at all. And this applies to everyone, men, women, young as well as elderly, everyone. Right? What we can do next is protect your skin every day. The sun might feel good on the skin, but the ultraviolet rays can quietly damage your skin cells and over time can turn into skin cancer. And this is especially true for the fair skinned individuals. So, how to protect from these ultraviolet rays? Use a broad spectrum sunscreen of SPF 30 or higher, even on the cloudy days. And try being indoors during the peak afternoon hours when the sun is overhead. Also, cover your skin with light clothing, wear a hat, and avoid tanning beds. Right? What else we can do is keep your stress in check. Stress itself does not directly cause cancer, but again, stress might push you to harmful habits like smoking, overeating, or skipping exercises, which in turn leads to increased risk of cancer. Try having good quality sleep. By that, I mean for adults, around 7 to 9 hours of sound sleep daily is required, a little bit higher for women, considering the hormonal changes. Um, like little bit less for the elderly age group, more than 65 years of age, usually require they around 7 to 8 hours of sleep. Right? What else we can do to prevent cancer is cancer vaccines, as we had discussed already regarding the HPV vaccine. Similarly, there is also hepatitis B vaccine, which prevents the HBV infection and eventually leading to liver cancer. The HBV vaccine has been included in the immunization schedule by the government. So, strictly follow the schedule and get all the vaccines as prescribed. Next is please don't skip the regular checkups and screenings. All the screenings that we discussed are very much important to prevent or detect the cancers at an early stage and get treated. So do not skip them. And the last, and I guess the most important, is don't fall for AI, Google, or WhatsApp self diagnosis. Yes, AI is a helpful tool. It can support doctors in detecting and managing cancers, but it cannot replace the expertise and personalized care of your oncologist. Technology can help us see patterns, but only doctors are the ones who can see patients, not AI. Right? Now that we have discussed about prevention, you might be wondering that what are the various treatment options for cancer? So, cancer treatment is not like one size fits all. It depends on the type, stage, and the health of the patient. Most cancer today are treatable and many are curable, especially when they are detected early. The various options you have after getting detected with a cancer are surgery, radiotherapy, chemotherapy, targeted therapy, immunotherapy, hormonal therapy, and the list goes on. It like the technological advance right now has been so much, and the scientific research has been so much that, as I had mentioned previously, that even stage 4 cancers are nowadays considered treatable and curable to a certain extent. So, to talk about these treatment options in detail is just out of scope of this session. So as we are heading towards the end of the session, there is like much more to explore, and I'm sure that this was a very heavy session for you all, but awareness is the first step. I hope I did not like give you a lot of data or a lot of medical term. I try to keep it in as simple language as possible. I hope you understood, and let us now have few questions if you have any in the comment section. Okay, I guess there are few questions.
Can you take some question, Dr. Shalin? Can they ask you?
Yeah, just a second. I'm going to the chat section. So, what about blood cancer? Blood cancer in itself is a completely different subject. So, it is related to genetics, but not all of them. Around 10 to 15% of the blood cancers are because of genetics. And nowadays, the blood cancer treatment also has improved to certain extent that even bone marrow transplant and even like to name few CAR T cell therapy and all has advanced so much that it also has become curable, completely curable, and people do live a long life free of cancer after getting a proper treatment. And also, there is a question that what about getting vitamin D if we avoid sunlight, and what time is suitable for sun exposure? Regarding vitamin D, ideally, honestly, like during the COVID time, most of us got vitamin D test done, and most of us, including myself, were in the deficient range. So regarding the vitamin D, we should be taking the vitamin D course every 6 months to 1 yearly. And during each course, we should be taking the 4 capsules of vitamin D once a week. I guess that answers your question. And what time is suitable for sun exposure? Again, it is the morning time of sun and not during the afternoons when the sun is overhead and when you have more chances of getting ultraviolet rays damage. Vitamin D is supposed to be taken once a week for 4 weeks. The one there is question is how does pranayam help against cancer? So pranayam helps reduce the stress level. What we discussed regarding the stress is it helps have a normal healthy lifestyle, avoid all these high risk factors like smoking, or it helps having a good sound sleep, which in turn eventually helps us avoiding cancer again. So how do we define cancer in family history? So there are first degree relatives, second degree relatives, third degree relatives. You, amongst your family tree, if the person from your maternal family or the paternal family are having cancer, at least if two people from the first or second degree relatives are having cancer, it is considered a positive family history. Or even if one first degree relative having cancer before the age of 50 years, it is considered as a positive family history. And in that case, you should be getting checked for the genetic mutation, which might be running in the family, and accordingly increase the screening. As we discussed for breast cancer, if you have a positive family history, you should be starting screening at an early age of 30 years. Otherwise, for rest of the females, it is starting at the age of 40 years. I hope that answers the question. If you still have more doubt, please do write in the chat or let me know. Then there is one more question. Should young boys up to the age of 24 also take cervical shot? So yes, that's what we discussed, that there is not guidelines yet regarding the age of the boys, but what is recommended is the active sexual male partners should be taking the cervix vaccine shot to prevent transferring the HPV infection basically to the female partner and avoiding the cervix cancer. Which superfoods help against this? Again, I like it is only maintaining the healthy habits, not eating out on the thelas. I know it is very tempting even for me. So to keep that self discipline, avoiding those fast foods, packets, and thela foods might help us having good immunity against cancer. Does consistent hemoglobin below 8 mean cancer? No, not directly. It definitely means anemia, and you should go and get more tests done to rule out the causes of anemia. Anemia is the low hemoglobin level, and it has multiple different causes. So, definitely, you should go and get checked for what is causing the hemoglobin less than 8. But it does not directly mean that you might be having cancer. I hope I covered all the questions and did not miss any. If there are still more questions, you can type in here.
I think there are no more questions. It looks like. Let me thank you, Dr. Shalin, on behalf of Shreekara World Foundation and the entire team of Shreekara, for spending your time in preparing such a detailed presentation and presenting it to us. It covered a lot of aspects which people are normally not really very clear about. You cleared a lot of facts and myths. It was very interesting. And you gave us a very good insight. As you said rightly, it is a very vast topic and it cannot be covered in one session. And
Yeah.
but at least you gave a very, very detailed, in-depth introduction to the entire subject of cancer. Cancer is such a disease that the name itself, shakes everybody, and you are dealing with
Okay.
cancer every minute, almost every minute. And hats off to you for all the work that you're doing, in your professional life, and your drive for this social contribution. And I remember when we approached you, you didn't take even a minute to say yes, I'm in. And so Dr. Shalini is on the panel of Shreekara World Foundation. We have a number of doctors, and Dr. Shalin is one of them. And as he rightly said, if anybody has any queries, questions, or anybody wants to have any kind of consultation, you can approach us, or you can directly approach him, and he is accessible. And This is a part of our Shrikara lecture series. So this was the first one in the health aspect. We'll be having our next lecture on diabetes in coming month, in December. We will circulate all the details of that program very soon. Do attend these lecture series, which are going to be very informative, very interesting, and eye-opening. So thank you, everyone who's joined us, spared their Sunday evenings with us, and I hope this session was beneficial. It gave you some good inputs, and looking forward to such more such programs and more such lectures, and looking forward to see you all again joining those lectures. Thank you so much, and good night. Thank you. Have a good week.
I want to
Absolutely. Yeah.
Dr. Shalin for handling our Shrikara girl Jasa's case. I mean, not only as a doctor, but from his heart also. She's only 11-year-old girl who is suffering. But thank you
so much, Dr. Shalin, and we want you again and again with us to help us, to guide us. Thank you so much, and thank you, audience, for joining. Hare Krishna.
Hare Krishna.